Prince George was identified as a test community for the STOP HIV/AIDS pilot project in 2010. 3 years later, the problem remains, but the funding is drying up.
Not just a bad case, right? It's an epidemic.
Prince George has one of the largest HIV/AIDS populations in BC. To stop the spread of the disease, the province committed $48 million for the STOP HIV pilot project in 2 test communities, Prince George and Vancouver, in 2010. 3 years later, though, the problem remains.
We're seeing that within our current geographical area that there's still a high rate of HIV infection still happening into the north. And we know that that's not the most accurate figure, especially when we look at remote communities that don't have access to testing.
25% of people with HIV don't know they have it, and as a result are responsible for 75% of new cases. And the STOP project aims to find them.
26% of the people who have HIV don't even know it, so they're constantly passing it on, right?
A recent report shows the number of infections in the north is on the rise, but the money is not. By 2015, the STOP project will receive about half the amount of funding it has now. In 2011, the BC Centre for Disease Control found the numbers were actually on the rise in the north. 21 new cases were diagnosed that year. This year, Northern Health received $2.5 million. 3 years from now, that number will drop to $1.2 million.
There is concerns, but in Northern Health, we always seem to find a way to keep our projects going somehow or another.
On April 1st, the initiative will spread across BC, opening up more testing sites in an effort to find that 25%.
Very important. If we can't capture those 25%, we won't stop HIV. We won't get our target of 0.
Kelly Lonahan, CKPG News.